From Boston University and BU Alumni Relations, welcome to Proud to BU Around the World. I'm your host, Jeff Murphy, and this season, we're taking the podcast on the road to meet some of our most interesting and accomplished alumni navigating life and careers in cities across the globe.
My guest today is Bryan Murphy-Eustis. Bryan earned an MPH from the Boston University School of Public Health in 2004. And from there, he launched his own public health consulting firm, BME Strategies. Bryan has dedicated his career to building resilience in local, state, and international health organizations. He led the operational design and implementation of the West African Ebola response coordinated by Partners in Health. Bryan is now working to develop and deploy new health technologies through global good at Intellectual Ventures. He joined me on the podcast to talk about the lessons he's learned as a public health practitioner. And of course, I also asked him to share his expert insight on the current coronavirus pandemic. Bryan, thank you so much for carving time out of your schedule to join us on the Proud to BU podcast. If you were at a dinner party, how do you explain to people kind of what you do? I mean, just looking at your LinkedIn profile, you've got a couple different organizations you're a part of. How do you tell people about your work?
Sure, and thanks, Jeff. It's a pleasure to join you. It's a bit confusing. I like sort of diversity in the work that I do, and so I guess I would start right now. I currently work on the commercialization team for Global Good, which is a global health technology company that specializes in building new global health tools for low and middle income country as part of the Bill and Melinda Gates Foundation. But I also started a small business about 15, 16 years ago called BME Strategies. So I serve as the executive director of that business as well as a number of other small initiatives I'm engaged with. But those are probably the two that take up most of my time.
And we're definitely going to dive in on both of those things. But, I think particularly of interest to me in sort of reading about your life and your work, that you founded this organization, BME Strategies, around helping organizations get prepared for global health problems, correct?
Yeah, mainly for domestic emergency response and emergency preparedness problems, of a public health nature.
No, and then, I bring that up because obviously, I want to talk about your life and your career, but with the times that we find ourselves in during the COVID-19 pandemic, I was quite eager to hear your take on things. I don't want to spend too much time talking about the fact that we're all, working remotely if we're working at all. But how has your life changed in the time since, the first diagnosis, over in China, that kind of thing? Tell me about what your life has been like lately.
Yeah. It's been, it's just like everybody. I think we're all trying to reassess what new normal is. And so my life has changed considerably. I not only, has spent a lot of time over the last month dealing with folks in my own family that have contracted COVID and their struggles and trying to make sure that they're healthy and safe, but also, BME Strategies has been really active in Massachusetts, working with local and state public health officials to try to respond to the growing number of cases there. As soon as the first sort of outbreak occurred, I think a lot of us in the epidemiological and preparedness communities were sort of tracking it closely, worried about what could happen. And I'm encouraged by seeing a lot of the response and the real heroic activities of healthcare workers, frontline healthcare workers, and others, and so many others. That it's really encouraging to see, and hopefully we get through this as soon as we can.
So given what you know about, emergency preparedness, if you had a magic wand to just change the course of this for the United States or for the globe, what are the things that you would focus on to sort of, help make this go away and also make sure that everybody's prepared for the next time something like this pops up?
I think the things that I would focus on are a lot of the things that people are hearing at the front and center of a lot of the coverage, which is, I think access to the necessary supplies that folks need, whether it's PPE for healthcare workers and for essential services that are still continuing to operate during this time, as well as access to testing, sufficient access to testing and antibody, as well as diagnostic, I think is really key. And then of course, sort of the the ongoing struggle that's happening to try to identify therapeutics or vaccine efforts. I think if I had a magic wand, I'd have therapeutics and treatment for COVID immediately. I'd have vaccine developed immediately, which of course is not possible. And then I'd also have the ability to communicate really clearly. I think everybody that's isolating in place is eager to get out there and to have normal, or what was normal, return and have the economy open back up because of so many struggles that are going on with what's happening there. And I think the hope is to try to really, encourage folks to still follow the science and stay working and doing their part to kind of isolate and try to contain this. I think those are the key factors.
And we're talking, I'm here in Massachusetts and you're in Washington State, in Seattle or just outside of it. Are things starting to, open back up in Seattle, or how much longer do you think everything's going to be, in isolation? And I don't want to call it a lockdown, but.
Sure. Yeah. So the cases themselves are we're starting to see a plateau and things kind of start to look promising in the Washington area. And so that's really good news, because obviously it sort of was a hotbed in the beginning and early stages of the U.S. outbreak. And so that's really encouraging to see. Things have not really laxed, I think, in terms of sort of businesses reopening. And that's a good thing, I think. I think we're not really at that point yet. All public health experts, and I don't necessarily want to call myself a public health expert, but I think all folks that are engaged in this work are hesitant to offer a prognosis of like when things will get better, because it depends on so many variables and so many factors, right. To know that. But I think that it's going to be a bit of time until we really do get back to what folks.
I mean, I'd love to continue to ask you to put your wizard hat on, and I could ask you all the questions I have, but I do want to rewind the clock a little bit. I mentioned you're in Seattle, but I saw online you attended Boston Latin School. Are you originally born and raised in Boston?
Yeah, I was. I was originally born and raised in Boston. Grew up in a number of different neighborhoods there throughout the city. Rosendale, Jamaica Plain, went to grade school in Dorchester, and went to Boston Latin for high school. It was a great experience.
And did you have anybody in your life as either early on or high school that made you think about getting into sort of health and public health someday? Where you went to abroad for your college experience, right? To London?
Yeah, I did. I went to undergrad at a small school in Southwest London. And I mean, probably early on, my biggest influence was just my family. I think the sense, community in Boston is a really strong, prideful thing. And I think I was not immune to that, and always felt like a sense of connection to my community and sort of an understanding that work, if you're fortunate to be able to do that, is great if you can align kind of your goal to support and strengthen your community with your work. And so it wasn't until sort of after I graduated undergrad that I started to explore health as the avenue for that. But I'd always, I think at a young age, believed in, community resiliency, supporting it, being an active member, and then part of my process was just like, well, what's the best way to do it? There's lots of ways to engage to help strengthen your community, whether it's education or business development or whatever it may be. And health just really connected with me.
I know you also did an MBA. Was that before or after your BU experience?
It was after, many years after.
Okay.
I think as I was sort of growing in my career and starting to take on more leadership positions where I was managing larger teams or bigger budgets, I started to realize I really should get some formal training in a lot of that aspect. So I went back to school and did an executive MBA program.
So what happens between college and coming to BU? Are you working full-time for a couple of years, or did you go right into your master's in public health?
Yeah, sure. So I took some time off. I took a year off after undergrad in London, and I flew back to Boston, and I started working as a social worker, doing kind of case management for folks living with developmental disabilities to support them and their goals to live and work independently. And I did that. I did that full time while attending BU as well. So I did it for a number of years, and kind of did it at the same time.
But your public health, you were a full-time student and working full-time.
Yeah, that's right.
Oh my goodness. How did you manage that?
It was busy. I was lucky because some of the shifts I could take on were shifts where I was, say, working overnight, where I could kind of be useful if there was an emergency or, so I was able to it was a little schedule finessing, but it worked out well.
So I'm guessing you probably had quite a different experience than a lot of your classmates. Tell me what stands out to you about your BU School of Public Health experience. Were there classes that really had an impact on you, or professors or projects that you worked on that really might have shaped your career?
Sure. Yeah. I mean, it was funny when I was thinking about going to public health school, I literally only applied to one school. I applied to BU. And that's because it was not only my hometown school and had a great reputation, but it matched what I was looking for in a school of public health. It really catered to the ability to work full time, right? They offered classes at times that were diverse, so you could kind of choose what would fit in your schedule. And it was known, and I think still is, as sort of like the practitioner school. I'm far more interested in sort of the operations and public health delivery aspects of global and public health, and I'm not besmirching any other schools, but some of them tend to be more research based in school, and that's just less of my interest. And so BU was just a great fit. And yeah, the classes were fantastic. I think everybody remembers Lisa Sullivan's courses on biostatistics. I just think she's such a dynamic teacher, and that always stuck with me. But I had fantastic professors, and extended beyond that. The career services department, I think, is remarkable. It's a real highlight of the school. Their practicum office is what led to the founding of my company, BME Strategies. So I got so much out of BU. Unfortunately, I got far less out of the social element that I think a lot of people may have benefited from. I just didn't get a chance to really engage in that side of the school, but the university and the resources itself were phenomenal.
I'm glad to hear that. I'd be curious to hear more about this practicum that you had that led to you deciding to found your company.
Sure. Yeah. So as part, I don't think this is still the case, it may be, but as part of the concentration in epidemiology, you had to, actually, maybe it was all of them, you had to do a practicum as part of your culminating experience. And I got a job working, at the time, they offered a practicum, a position with the Massachusetts Department of Public Health, where they would place you within a local public health department. So you would get experience understanding sort of how local public health is delivered in communities in the state. And I was just super lucky that I ended up interviewing with the Needham Health Department at the time, and they had a director named Dr. Janice Burns, and she was just dynamic, just like a pure, truly, I don't know how to say it, a mentor by her core. And so I did a few-month internship with her. And during that process, she was the type of mentor that would also just tell you to just try anything. You never written a grant before. Like, what's the worst that happened? They say no. Like, go ahead and write the grant. Or you haven't tried drafting this article for the newspaper describing this public health issue. Like, give it a shot. And so she would just give you a ton of exposure and a ton of mentorship. And so at the time, she asked me to write the commute. This was sort of right after 9/11 in the Department of Homeland Security. And so there was funding that the federal government was earmarking to states and local municipalities to prepare for emergencies, particularly after, the anthrax issue that happened in Washington, D.C. They were realizing that there just needs to be real resiliency in local communities throughout the country. And so each health department had to write a risk communication plan. And Janice asked me to write it for Needham. And when I drafted it, my practicum ended, and so she called me back and said, hey, we need to write an emergency operations plan that would be about not just how we communicate risk, but really how our department and community would respond to any public health emergency. Would you think about consulting with us and writing it? So, I joined to write that. And then after I'd written Needham's plan, I think Somerville read Needham's plan, and then Cambridge read Somerville's, and then eventually, I ended up realizing, this is something that, it just became full time. I would write. I think at one point I'd written like 130 of the 351 cities and towns health department plans. So then the state government asked me to write the state Department of Public Health plan, and it just ended up growing fast because of those opportunities that I was just really lucky.
So wait a minute, you wrote one as a current BU SPH student, and then after founding your company wrote all those other ones, or what?
Well, so yeah, it's funny. I wrote one section of one plan. I just wrote the risk communication section during my practicum. And then I was sort of hired to write the overall plan for the community. And then once I had written sort of many different cities and towns plans, I started to just get more business than I could handle. So I started to take on other consultants that could work with me, and we would take on other projects, and we'd get asked to do all sorts of other stuff, not just with maybe cities and towns, but with hospital groups that wanted to write, hospital evacuation plans or things of that nature. And so we ended up I ended up opening up an office and trying to set up a business, just really coming out of the practicum.
So the work, it sounds like the work kind of came before the idea to really start a business.
Oh, absolutely. Yeah. I wish it's funny. People are like, well, how did you start BME Strategies? What made you? And I wish I had this like grand entrepreneurship spirit of this, like, oh, I had this vision for what the company would be, but no, it was truly happenstance. I did one thing and then somebody asked me to do the same thing. And then pretty soon I had a lot of opportunity.
Well, as an entrepreneur then, I mean, obviously you've got this passion for the work and helping communities and readiness. What did you learn about running a business that you looking back now, what do you know now that you wish you knew then?
Oh, wow. That's a great question. So much. I mean, I think I've learned a ton along the way. I think, every business is unique. And so there's certain attributes and characteristics that I think serve one industry more than another and that are really key. I think, working with local public health and state public health and working in preparedness and response, I think, there are key characteristics that have really benefited and skills I've sort of developed over the time. I think the ability to build consensus, right, to work collaboratively across jurisdictions and departments, is sort of a consulting skill that feels like a soft skill, but once you kind of use it and access it a lot, you realize it's just so critical in everything I do. Just, because often, we were brought into a project where it might be 10 different cities and towns and their directors of health or their fire chief or police chief. And you're trying to get them to build capacity around responding in which, you're not any of their managers, then nobody reports to you. You're just trying to help them get to their goal and supporting them through lots of different opinions and senses of the way to do things. And so, that skill is something that I really am thankful for, that I think is pretty unique to that consulting role. I think, management and supporting people in their ability to grow in their careers and their ability to try new things and feel confident to explore their abilities is something that I think Janice and other mentors I had was so useful and really helped support in me, that I think I wish I knew early on how amazing it is to really focus on that and make that a core part of how you mentor or manage others.
So, founding and running your business that you still are operating today, what percentage of your time are you running the business versus actually doing sort of the practitioning, the work that you're so passionate about? How do you split that up?
Yeah, so I guess almost 10 years ago, I sort of made a transition from a lot of the day-to-day work. So I still engage with the business in a small way to support kind of the consultants that we have doing the work. But a lot of my time shifted. In 2011, I shifted to working in global health with an organization called Partners in Health that has offices around the world, but also has one in Boston downtown. Sure. And they work in global health delivery. And sort of really poor, marginalized communities, really resource poor, marginalized communities in Rwanda, Haiti, Malawi, Liberia, Sierra Leone. And so that was in 2011. I joined them, and that shift for me is when I stopped doing, I think, like the full on work with BME Strategies and really supporting it on a more part-time basis. And of course, now I'm in Seattle, and so also still just, part-time support BME, but really focused on my work with Global Good.
So when you were in Partners in Health, were you living in Africa, or was it a situation where you were sort of like, traveling back and forth all the time?
Yeah, it varied kind of throughout my time with Partners in Health. I spent about 7 or 8 years or so with Partners in Health. And at times I would live in Africa, and other times I would be back in Boston. So for the first year and a half, I lived in Malawi. In 2014, I went to Liberia and Sierra Leone to support the Ebola response work that Partners in Health was beginning to get engaged with. And then I stayed in Liberia for a couple of years after to sort of support the government in their effort to rebuild following the Ebola response.
No, that Ebola response work is something I definitely wanted to talk to you about. Obviously, in getting ready to chat with you today, I spent some time just Googling you to see what comes up. And, you're quoted in this Atlantic article talking about the work that you had done around Ebola and the fact that, and I apologize, I don't know which specific country you might have been talking about, but that Ebola, I think the quote was something around the lines of, Ebola took advantage of a fractured healthcare system, and Ebola just completely eroded the faith or the confidence that, Africans had in their healthcare systems. Are you concerned at all about something similar happening here as a result of the coronavirus?
Yeah, absolutely. I think that's a really great point. And I think it's something that I am very worried about and I think is pretty critical. I feel like when you look at the history of emergency response, and particularly with public health disasters, the communities that are hit the hardest are the ones that are most marginalized, that lack that have the greatest lack of access to high quality health care. And so what we may see, I hope not, but what we may see is COVID, the impact that it could have in Africa and low resource countries is really scary, and I think something that we really need to be paying attention to.
So tell me about I don't know if it's a change for you, but obviously, you talked about intellectual ventures and your work on global good. Tell me more about your role there.
Sure. Yeah. So Global Good is an organization that is focused on developing new technology and global health tools to address a lot of the needs for healthcare delivery in low resource countries around the world. And so my work with Global Good is focused on the commercialization side of the products that we develop. So it's to work with companies that might be willing to manufacture and distribute. So at Global Good, it's really about inventing the technology and then finding partners that can help scale it. And so I support that end of the work of working with ministries of health or governments to help think about how the products could be scaled through their country, or working with companies to help think about how they could manufacture and distribute the companies and think about what the value propositions are for these products in certain markets and communities. So that's the work that I focus on.
And is that taking up the majority of your time now? Because your company is still operating, right?
Yes, yeah, it is. And so, yes.
So how do you balance all that?
Yeah, it is. I mean, it's very busy, and there's lots of work to do, and there's a number of projects that we're engaged with that are still continuing and still active. There's also efforts within the company to do work focused on COVID response and to meet the needs of the growing challenge that we're facing today. So yeah, things have been quite busy.
So when you look back to who you were as a student at the BU School of Public Health, would that person be surprised at all to see the kind of projects that you're working on now, or kind of how you even think about public health?
Sure. Yeah, I would say I had no idea. I guess I didn't really have an expectation of where things would go. And sort of what I would be engaged with. I knew I wanted to support, like I said, support sort of community growth, and I felt like health is so critical to how communities flourish and how they are strengthened. It's really hard to go to work and be active and go to school when you're in poor health, and so I think I had always hoped I would work in this area. And so I guess I'm proud of the fact that I do work on these things. I think they're really important. And so I'm glad to be a part of that effort. But I didn't really have an expectation of where that would take me. And looking back so far in my career, I'm pleased that I've had just such great experiences and worked with such tremendous people. I didn't necessarily expect it, but very thankful for it.
Do you have a clearer understanding or idea now about where you want to go, about the kinds of projects that you want to work on? Or is it, is your operating philosophy to still just sort of do it day by day and project by project. And do you have a master plan for yourself in the remainder of your career?
No, I don't know. It's a tough question. I would like to think about being very deliberate in sort of a, 5-year. But people, you often hear people saying you should have 5-year goals or 10-year goals, and I don't know if I've ever really fleshed those out for myself. I think I've been struck by how much of career pathways are not only happenstance, but really are wonderfully enhanced by being open to the opportunities that appear. It's not to say to put everything up into karma, but I've been very lucky to, I think the example I gave of like BME Strategies and the way that business grew organically, but also, I joined Partners in Health on a 1-year internship through the Global Health Corps. And that took me into a 7-year career with that organization that was wonderful. And so I hesitate to say that this is where I want to be in 5 years, and this is who I want to work for, what I want to do. But I want to stay active in global health, and I've always wanted to be focused on what are the ways to deliver the highest impact for I think those that stand to gain the most or that So that's really what I'm focused on.
And given the career you've had, do you think, is that, maybe it's not intentional, but I can't help but wonder if that might be advice you'd give to somebody who's just getting started out, to maybe not be so focused on creating the plan, but more so on the, focus on what's in front of you and take it step by step. Because I think that, nobody's plan always goes the way they think it's going to. So is it conscious or unconscious that you've done it that way?
Yeah, I don't know. I think you make a great point. I really do believe that that would be advice. I think the way you described it is perfect. I think I would absolutely encourage others to be less focused on sort of where ultimately they think they'll go, and more on, as cliche as it is, more on the journey and more on what they're learning and how they're growing and building skills. I think like the only reason I went back to do an MBA was because I thought, hey, this would be useful. There's projects that I'm sitting with today on my desk that I would benefit from knowing some of this stuff. There's budgets that if I knew how you do the proper accounting treatment of a lease, that the place we rented in Liberia would add my understanding of how that would be structured would be different. And so I think that led me to things that I'm glad I did, because it was sort of what was needed at the time. And I think, I guess that would be the encouragement, that and to not, to be willing and open to making large leaps and changes if what they're seeing in front of them is dictating that or encouraging that.
Well, Bryan, with everything that's happening in our world, I know there's probably a lot of other things you could have spent 30 minutes doing. So I really appreciate that you carved out some time to talk to us on the podcast.
No, it's honestly my pleasure, Jeff. Really, I have tremendous love and appreciation for all that I've received from BU, and I think I get a chance to engage with the alumni and current students somewhat frequently, and I'm always just struck by what a great school it is, and thankful for any time I get to engage back with it. So thank you.
Oh, it's my pleasure. Thanks, Bryan.
Okay, thanks.
Thanks again to Bryan for joining me on Proud to Be You. And my thanks also go out to all those public health professionals who are working tirelessly to improve the well-being of communities around the world. To connect with Bryan on LinkedIn and to see the many ways BU's School of Public Health is responding to the COVID-19 pandemic, be sure to check out the links in the show notes of today's episode.
On behalf of everyone on the BU Alumni Relations team, thanks so much for listening to Proud to Be You. If you enjoyed this episode, please be sure to subscribe, rate, and review our podcast wherever you find your episodes. I'm Jeff Murphy, and no matter where your path takes you, be proud to be you. The Proud to Be You podcast is produced by Boston University Alumni Relations. Our theme is from Jump and APM Music. To learn more about Proud to Be You, visit bu.edu/alumni/podcast.